Unit 45, infections. A, fever. An medical student has made some languages notes on a case report. Case 45. 45. A 24 years old man presented with a fever which he had had for 3 days. On the third day, he had had a severe attack of a fever with Sweden and rigors. The only past history of a reliable events was hepatitis 4 years earlier and glandular fever infection with the Epstein-Barr virus. At the age of the 18 years, he had returned from Africa 3 weeks previously. Fever, paraxia, also remember PUO, paraxia of unknown origin. Fever also known as temperature. I've got a temperature. Adjectives febrile and paraxia. Opposite aperixial. Some symptoms of fever: sweating, rigors, shivering, and sensation of coldness, also known as chills. Microorganisms. Infections differ from other diseases in a number of aspects. Most importantly, they are caused by living microorganisms such as viruses or bacteria that can usually be identified thus establish the etiology early in the illness. Many of these organisms, including all bacteria, are sensitive to antibiotics, and most infections are potentially curable. Unlike many known infections, degenerative and chronic disease, communicability is another factor which differentiates infections from non-infectious disease. Transmission of pathogenic or organisms to other people, directly or indirectly, may lead to an outbreak or epidemic. Finally, many infections are preventable by hygienic measures, by vacuums, especially leaf attenuate vacuums such as rubella vacuum, or by drugs prophylaxis. For example, chloroquine to prevent malaria. Microorganisms include bacteria, viruses, fungi, protozoa, such as the parasite that cause malaria. Another general word for these pathogens is microbes. Patients often refer to microbes as germ or bugs. Notice the common expression for acquiring an infectious disease. Could he have coughed, pick up some disease from the dog? I think I've caught the flu, but that's going around. C. Source and spread of infection. Here is an extract from a medical textbook. Infection may originate from the patient endogenous, but usually from skin, nasopharynx, or bowel, or from outside source exogenous. Often, another person who may be either suffering from infection or carrying a pathogenic microorganism carriers are usually curly and may harbor the organism in the throat. For example, diphtheria, bowel salmonella, or blood hepatitis B or HIV. Non-human sources of infection include water, E.H. cholera, milk, E.H. tuberculosis, food, E.H. botulism, animals, E.H. rabies, birds, E.H. phytosis, and also the soil, E.H. Legionella disease. The incubation period is the period between the invasion of the tissues by pathogens and the appearance of the clinical features of infection. The period of the infectivity is the time that the patient is infectious to others. Unidad 24, infecciones. Fiebre. Es un estudiante de medicina ha tomado algunas notas lingüísticas en un informe de caso. Caso 45. Varón de 24 años que acudió con fiebre de 3 días. Al tercer día había tenido un fuerte ataque de fiebre con sudoración y rigidez. La única historia pasada de relevancia fue hepatitis, 4 años antes y fiebre glandular, infección por virus de Epstein-Barr. A la edad de 18 años había regresado de África 3 semanas antes. Fiebre. Pirexia. Recuerde también PUO, pirexia de origen desconocido. Fiebre, también conocida como temperatura. Tengo temperatura. Adjetivos, febril, febril y pirexial. Opuestos a febril, apirexial. Algunos síntomas de fiebre, sudores, rigores, escalofríos intensos y sensación de frío, también conocidos como escalofríos. B. Microorganismos. Las infecciones se diferencian de otras enfermedades en varios aspectos. Lo más importante es que son causadas por microorganismos vivos, como virus o bacterias, que generalmente pueden identificarse, estableciendo así la etiología en una etapa temprana de la enfermedad. Muchos de estos organismos, incluidas todas las bacterias, son sensibles a los antibióticos y la mayoría de las infecciones son potencialmente curables, a diferencia de muchas enfermedades degenerativas y crónicas no infecciosas. La transmisibilidad es otro factor que diferencia las infecciones de las enfermedades no infecciosas. La transmisión de organismos patógenos a otras personas, directa o indirectamente, puede provocar un brote o una epidemia. Por último, muchas infecciones se pueden prevenir con medidas higiénicas, con vacunas, especialmente vacunas vivas, atenuadas como la vacuna contra la rubiola, o mediante la profilaxis con medicamentos, por ejemplo, la cloroquina para prevenir la malaria. Los microorganismos incluyen bacterias, virus, hongos, protozoos, como el parásito que causa la malaria. Otra palabra general para estos patógenos es microbios. Los pacientes a menudo se refieren a los microbios como gérmenes o insectos. Observe la expresión comunes para adquirir una enfermedad infecciosa. ¿Podría haber contraído o cogido alguna enfermedad del perro? Creo que he cogido el virus de la gripe que está circulando. Fuente y propagación de una infección. Aquí hay un extracto de un libro de texto médico. La infección puede provenir del paciente endógena, generalmente de la piel, la nasofaringe o el intestino, o de fuentes externas, exógenas, a menudo otra persona que puede estar sufriendo una infección o portar un microorganismo patógeno. Los portadores suelen ser sanos y pueden albergar el organismo en la garganta, por ejemplo, difteria, intestino, salmonela o sangre, hepatitis B o VIH. Las fuentes de infección no humanas incluyen agua, por ejemplo, cólera, leche, por ejemplo, tuberculosis, alimentos, por ejemplo, botulismo, animales, por ejemplo, rabia, aves, por ejemplo, citacosis y también el suero, por ejemplo, legionela. Enfermedad de legionario. El periodo de incubación es el periodo entre la invasión de los tejidos por patógenos y la aparición de las características clínicas de la infección. El periodo de infectividad es el momento en que el paciente es infeccioso para otros. Now, we're going to complete those exercises. Match the two parts of the sentence. Look at A, B, and C opposite to help you. First, in 1988, saw the UK launch of Olive Attenuate, measles, mumps, and rubella, and MMR vacuum. Chickenpox varicella is a common infectious disease of childhood. Rabies has an incubation period ranging from 4 days to many months. The patient remained in the febrile age with peaks of temperatures of 30, 39.5 C. He was admitted with a 4-day history of influenza-type symptoms of fever with rigorous malaria and general malaise. Quite a proportion of patients who recover from hepatitis B become carriers of the virus. The central part of Africa is in the midst of an epidemic of AIDS. Measles rubella is most infectious during the catarrh stage. Lyme disease is caused by transmission of B. bordeaux from an animal to man by exotic ticks. And 10 plus stands for pyrexia of unknown origin. origin. Complete the case. Report the patient in opposite to look at A, B, and C opposite to help you. Case 45. On examination, he looked unwell. His pulse rate was 100 minute per minute. He had a painful spleen. The combination fever and rigors in patients who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10-14 days. In this case, the patient admitted he had not been taking prophylaxis regularly. The diagnosis was confirmed by the presence of parasites in his blood film. Complete the sentence. Look at A, B, and C opposite to help you. An infection which can be treated successfully with antibiotics is curable. Another word for an epidemic is an outbreak. Bacteria and viruses are examples of microorganisms. Someone whose temperature is normal is a fever. The common infection with Epstein-Barr virus is known as glandular fever.